Assalamu alaikum everyone, this is our PHVR once again from the platform of pharmacology. So what are the antibiotic classification? Let's begin the lecture. Cell wall synthesis inhibitors, protein synthesis inhibitor, DNA synthesis inhibitors and folate inhibitors. So the drug include in the cell wall synthesis inhibitors, obviously it is a penicillin, cephalosporin, vancomycin, and protein synthesis inhibitor drug include the aminoglycosides, macrolide, tetracycline, lincosamide. These are all the protein synthesis inhibitors. And DNA synthesis inhibitor, obviously it include the quinones, fluoroquinones and metronidazole. Folate inhibitor, sulfonamide and trimethoprim. This is basically the best video for reviewing all of the topics of antimicrobials or all of the previous topic that you watch in the recent playlist of the antimicrobial. So the drug include in the penicillin or penicillin G, V, methicillin, neficillin, oxycillin and all of these mentioned drugs. Then aminopenicillin include the amoxicillin, which is the most commonly used penicillin in the clinical practice nowadays, and ampicillin. Obviously its mechanism include the cell wall synthesis inhibitor that I described previously in my previous videos. So its major side effects include the hypersensitivity reaction and rashes, nausea, vomiting. The action of penicillin are inhibited or stopped by the beta lactamase. So we use it in the combination of the beta lactamase inhibitors, amoxicillin and clavinic acid, and tazobactam and piperacillin, salbactam. So these are the some beta lactamase inhibitor which ultimately increase the activity of these penicillins. So the main side effect of the penicillin are the pseudomembranous colitis, that is symptomized by the diarrhea, intestinal nephritis, hemolytic anemia, which can be seen by the Coombs test. Penicillin or all beta lactam are not effective for mycoplasma bacteria. So this is basically the trick point. So moving on the next topic, that is cephalosporin, which is very complicated and at the same time tricky topic to memorize. So the drug include in the first generation cephalosporins are cefazolin, cephalothin and cephalexin. Cephalexin, which is used in pharyngitis, and it is a drug of the choice in the pharyngitis basically and cellulitis. Cefaheparin, which is eliminated hepatically and renally with the shortest half-life, that is 0.6 to 0.8. This is the important point from the topic of or the classification of cell wall synthesis inhibitor, specifically the drug class, that is cephalosporin. Cefatroxin, which can be given orally. So the important point of the first generation cephalosporin, none of them enter in the CN. So this is the second generation cephalosporin, and as you can see the drug mentioned in the second generation cephalosporin. So the important and very important point from the second generation cephalosporin, that include the cefuroxamine sodium can cross the blood-brain barrier and it can be used in the community acquired bronchitis or pneumonia in elderly. So with the continuation of the second generation, cefuroxamine oxytil oral is stable for 24 hours when it dissolves in apple juice, and cefproxil that can be given by oral route. Now the third generation, which is the most important generation of the cephalosporin, that include the cefixime, cefoperazone, and all of these drugs you can see in the table. Also with that, fourth generation include the cefepime. Kinetics is not completely understood, contain amino sugar structures and have low bioavailability, primarily used in the infections associated with the gram-negative. Aminoglycoside have little activity against anaerobic bacteria. So the summary of the aminoglycoside is itself amino, that is A is allergy, M is neuromuscular blockage, I inactivated when physically mixed with beta lactam, N is nephrotoxic, and O is ototoxic or optic nerve toxicity. So when I ask what is an important side effects or the adverse effect of the aminoglycosides, so that are the nephrotoxicity and ototoxicity. The major side effect of the vancomycin is Redman syndrome. Okay, when we talk about its half-life, it's 2 to 4 hour. However, parental injection are given every 6 to 12 hour. Aminoglycoside have post antibiotic effect. Highest ototoxicity is caused by streptomycin, and highest nephrotoxicity is caused by the neomycin, or you can also memorize this by nephrotoxicity and is linked with, and that is neomycin. Ototoxicity symptoms is associated with gentamicin and streptomycin are vestibular damage. This can cause the tinnitus and vertigo, ataxia. Ototoxicity symptom associated with amikacin and kanamycin are auditory damage, which can cause the hearing loss. So here you can see the two type of the ototoxicity symptoms, that are vestibular damage and auditory damage. So the vestibular damage is caused by the gentamicin and streptomycin, and auditory damage is caused by the amikacin and kanamycin. Next is the tobramycin, can cause both the vestibular and auditory damage. To prevent the serious side effect associated with aminoglycoside, monitor its level, burn level, that is a blood urea nitrogen level, serum creatinine levels, and also measure the peak and the trough level. Trough level of gentamicin are greater than 2 mcg per ml, can cause the nephrotoxicity, and this is an important point. So the next topic is macrolides. Macrolides include the erythromycin, clarithromycin, azithromycin, and telithromycin. You can use these drugs in various conditions, and previously in the COVID condition and in the pandemic, azithromycin is the most commonly used drug because of its spectrum of activity or the unique spectrum of the activity. So macrolides also lie in the category of the obviously cell wall synthesis inhibitor, no, protein synthesis inhibitor. So macrolides are also lie in the category of the protein synthesis inhibitor, and here you can see previously I described the classification. Protein synthesis inhibitor, macrolides. Okay, pharmacokinetics, all of the macrolides are hepatically eliminated except the clarithromycin, which is renally eliminated. Clarithromycin is renally eliminated, and all of the drug have the oral dosage, and erythromycin and lactobionate is IV. Azithromycin have the longest half-life, that is 68 hours, so it can be used in the single dose only. Erythromycin has a shortest half-life, that is 1.2 to 2.6 hours, so we increase the frequency of erythromycin and dosing of the erythromycin per day. Erythromycin are preferred drug for the treatment of the mycoplasma infection. Important alternate in patient with allergic with the penicillin. Erythromycin acetate may cause the cholestatic jaundice in patient, and use in more than 10 to 14 days. Okay, these symptoms may be resolved after the discontinuation of the drug. Erythromycin is inhibitor of cytochrome 3A4, thereby potentiate the toxicity of a drug that are metabolized by this particular enzyme, that include the digoxin, corticosteroids, lovastatin, or ALS or carbamazepine. Clarithromycin increase the warfarin INR, that is the international normalized ratio, so you have to monitor the PT, increase the digoxin and theophylline levels. Azithromycin is more active against the gram-negative H influenza than erythromycin. Clarithromycin is effective for H. pylori, so that's why it is used in the proton pump inhibitor along with the proton pump inhibitor in the triple therapy, that is used in the H. pylori eradication therapy. The next classification is tetracycline. Tetracycline have many drugs within a classification that include the demicocycline, doxycycline, and mincocycline, that is a broad spectrum antibiotic. Tetracycline used in the treatment of the acne treatment, chlamydia, rickettsia, that is a ronchi mounted spotted fever, mycoplasma pneumonia, and Lyme disease. So its side effects include the tetracycline. Tetracycline should not be treated to renally impaired patient. Why? Because it is renally eliminate out. Contraindication: pregnancy, breastfeeding children under 8 years old. As a pharmacist, what you have to counsel to the patient when you prescribe the or dispense the tetracycline: must take on the empty stomach with a glass of the water, and it have the tendency to bind with the bi and the trivalent ions such as calcium, magnesium, and aluminum ions. Tetracycline must stain teeth for topical, can stain cloth. So this is the major adverse effect, or you can say the major side effect by this drug or by the use of this drug. So when you dispense this drug, you must have to counsel the patient by this side effects. So it can continue the use of the cosmetic stinging may occur, and that may resolve shortly. Tell patient to report continuous nausea, vomiting, and avoid the prolonged sun exposure, yellowing of the eye and the skin. So the last drug in the classification of protein synthesis inhibitor is clindamycin, which lie in the lincosamide class of the drug. Clindamycin is used for the gram-positive anaerobic bacteria, Bacteroides fragilis, which cause the abdominal infection, diarrhea. Treatment: C. difficile is resistance to clindamycin treatment. Its side effects include diarrhea. For this condition, obviously I described previously that the drug of the choice and the medicine used in the treatment of C. difficile infection or diarrhea is vancomycin or metronidazole. Metronidazole we will discuss in the upcoming video. So contraindication: history of colitis, which. So our next topic is ciprofloxacin. Ciprofloxacin belong to the class of the drug that is DNA synthesis inhibitor. So previously I discussed the cell wall synthesis inhibitor and protein synthesis inhibitor. In the DNA synthesis inhibitor, it include the ciprofloxacin. So its mechanism, obviously it inhibit the DNA replication of the bacterial grace, that is DNA grace, and it is used in UTI, which is caused by the E. coli. Also it is used in sexually transmitted diseases, so that is gonorrhea. It is used in respiratory infection, alternate to ampicillin in pneumonia. It is also used in the GI infections. So if we summarize the mechanism of action and the therapeutic use of the ciprofloxacin, it is used in the sexually transmitted diseases, and it is used in the respiratory infections, alternate, or the if the patient is resistant to ampicillin in pneumonia, or specifically it have the spectrum of the activity against the E. coli. So it is also used in the GI infections or the E. coli induced travelers diarrhea. Now its side effects: most common side effects are nausea and vomiting, lightheadedness, nephrotoxicity, cartilage toxicity. Cartilage toxicity is the major ADR of the ciprofloxacin. Tendinitis, that is a tendon rupture, which is a common in elderly and renal failure patient. Why renal failure patient? Because the drug accumulate in the body in the renal failure patients. So what you will counsel the patient if you dispense or prescribe to the patient ciprofloxacin? Cipro-otic drops. Store cipro-otic suspension at the room temperature, that is 15 to 25 degrees centigrade. Do not use otic suspensions under the age of 2 years. Auxiliary labels: with or without food. The preferred time is 2 hours after meal for faster absorption. With a full glass of the water. Avoid dairy products. Take calcium after 2 hours. Avoid taking with an antacid, iron and calcium together. it have the tendency to phototoxicity, so sunscreen may not effective. Drug should be discontinued at the first sign of the toxicity, like the skin burn, like rashes. The next drug in the classification of antimicrobials is metronidazole, which belong as an antiprotozoal drug and has an antibiotic actions against the anaerobic bacteria specifically. So its mechanism, its mode of action is thought to be breakage of the cell DNA. Is therapeutic use indicated in the anaerobes such as bacteria C. difficile and C. vaginalis, protozoa, Giardia lamblia, Antamoeba, and Trichomonas. Get metro. This is basically the mnemonic for the metronidazole. If you have to memorize the spectrum or the spectrum of the activity of metronidazole, then it is a GAT. GAT means Giardia, Antamoeba, and T for the Trichomonas. GAT and metro is obviously for the metronidazole. So by this way you can learn the spectrum of activity of metronidazole. This drug is also effective against the trophozoite in the intestinal lumen and wall. Metronidazole has direct anti-inflammatory effect, antioxidant action that contributes to its anti-inflammatory activity, because all of the anti-inflammatory drugs having the antioxidant activity by which they can produce or activate the anti-inflammatory action of the particular drug. So metronidazole used orally in this type of the infections caused by these protozoa. Side effect obviously metallic taste, furry tongue, and glossitis. Must avoid taking alcohol on this drug, can cause the disulfiram like reaction, and it have also potential to cause the neurotoxicity. Drug-drug interaction with cimetidine that prolong the metronidazole half-life and decrease its plasma concentration. Now the next is the drug-drug interaction with cimetidine, warfarin, disulfiram, and phenobarbital. With phenobarbital, it increase the metronidazole metabolism. With warfarin, it increase the prothrombin time. That means it increase the activity or prolongation of the warfarin effect. Cimetidine, it prolong the metronidazole half-life and decreases plasma concentration. Disulfiram cause acute psychosis even if taken with 2 weeks. So the next is precautions. So it can cause the dark urine. Do not mix IV metronidazole with any other drug. Pregnancy and lactation. Caution required in the pregnancy and the lactation dosage. It is available in the injection form with the name of Flagyl, that is the most commonly used drug, and oral capsule, oral tablet, vaginal cream, and inserts, gels, and topical cream or gel. So it is a drug of the choice for the rosacea applied effected daily, morning and the evening for the 9 week, then as needed. So the next classification of the drug is folate antagonists that are sulfur drugs, with an exception of the one drug that is trimethoprim, obviously as seen by its name. It is available in the combination with the name of the cotamazole. Its mechanism, obviously it inhibits the folate synthesis and it is a folate antagonist. It can be used in the UTI which was caused by the E. coli. It is a drug of the choice in the traveler's diarrhea and used in the trichoma, chlamydia. Trichoma, most common cause of the prevental blindness, and topically it can be used in the burn and award, which is the most commonly indication of the cotamazole. So its major side effects include crystalluria, hypersensitivity reactions, connectors. Connectors is basically the newborn occur in the newborn because sulfur displaces bilirubin from binding. So this is a major and the unique side effect of the cotamazole or the sulfur drug. Sulfasalazine drug color urine and may color skin orange and yellow. This is a major and the unique feature of the sulfasalazine. So you must counsel this to the patient that you will not worry about this side effect. May permanently stain soft lands. Take drug after meal to reduce the GI stress and facilitate the passage into the intestine. Cotamazole, which is obviously the combination that I described previously of the folate drug with the trimethoprim. Its therapeutic use is chronic treatment of the UTI, gram-negative H influenza, and Klebsiella, Salmonella, E. coli, Shigella, and Vibrio cholera. Gram-positive species, as you can see, UTI, acute, recurrent, chronic upper and lower respiratory, chronic bronchitis, immunocompromised children, not indicated in infection associated with pseudomonas and microcosm. So what is an important and the unique point of this drug? Cotamazole is immunocompromised children, is used in immunocompromised children. So its a major side effect are skin reaction, severe in elderly, GI in the GI it causes nausea and vomiting, and blood related issues like the thrombocytopenia, leukopenia. So basically it is not used in the patient with the which have the tendency to decrease the all of the WBCs, platelets and RBCs, like in the leukemia and in the thrombocytopenia conditions, that is an ITP, or the patient having the bleeding disorders. So it is not used. Obviously the above three effects can be reversed by concurrent administration of the folinic acid. What is folinic acid? Basically this drug lie in the category of the folate antagonist. So folinic acid activate this pathway and produce the DNA synthesis and RNA synthesis. So ultimately there is a formation of all of the cell lineage that are the platelets and WBC and RBCs. So this is basically the antidote in a some way. Hemolytic anemia, G6PD deficiency due to the SMX. Counseling drug is not for IM. Shake oral suspension thoroughly before use. Take oral dose with a full glass of the water, with or without food. It must be taken, and store it in an amber glass bottle. Store at room temperature until expiry, and protect from the moisture, obviously, like contraindication last trimester of the pregnancy, lactation, and children under 2 months must take in, may cause the connectors which I will describe previously. It is a major and the unique ADR as the side effect of this drug. So that's all from this video and this antimicrobial part. Inshallah I will discuss and review the antiviral and the anti-cancer drugs in my upcoming videos. Take care. Until that, take care and Allah Hafiz and keep learning.